guys, Dr. Andy here. Today I want to demo Graston therapy for nagging mid and upper back pain. So Graston therapy is instrument-assisted soft tissue mobilization. Whole lot of jumble of words, but basically it comes down to we are using an instrument to assist us in doing some soft tissue mobilization. Think of that as muscle work, right? So we are using some metal, stainless steel, surgical stainless steel actually, instruments to help us break up muscle adhesions and speed up the healing process through here. All right, so the very first thing that we need to do is to make sure that the little tools glide nice and smooth is we put on an emollient, mostly beeswax, right over the skin. What that allows the tools to do, the instruments themselves, is to glide nice and smooth, okay? So this is actually my favorite technique for nagging upper back pain, okay? So if you're a desk worker, this is especially for you. Some of our heavy lifters, chest or upper back, or even we see a lot with like back squat too. Teachers, you guys develop a lot of upper back pain right through here. Some of it is posture related, but a lot of it is just repetitive stress, maybe in the gym. And just this nagging little pain right through there, kind of the tip of the shoulder blade, the upper inner tip of the shoulder blade. And even after we've done some manipulation, some regular muscle work, the pain just does not want to go away. It is like a stabbing pain right through there. Nothing I do, maybe what I do helps for a little while, and then it kind of comes back and it's just like there's a knife in your back right here, right? So that's when we take out the Graston tools and we kind of dig in through here, because this is where we get some of the biggest effect. It is my favorite technique for this nagging upper back pain, okay? So we've got these surgical stainless steel tools, and what we are doing is we're going to start off by gliding on the tissue. And believe it or not, it's as simple as this, but I can actually feel through the instrument where all of the muscle adhesions are, where things are tight. You have these little cells in the body called fibroblasts. Fibroblasts are in your connective tissue, so in here in the muscle, and on top of the muscle and surrounding the muscle. They are responsible for helping you heal after an injury, all right? And they are pressure sensitive. So when we find those injured areas with the bigger tool, we actually want to get in there and put in a good amount of scraping, good amount of force. And you maybe have seen some other videos where you see the patient, they get purple, right? Or there is bruising or something like that. No, you don't want to do that. There's no reason why you would ever want to bruise a patient, right? You actually just go to the point of maybe some little red dots, which is called petechiae. And we just take this tool, and after we find the little spots, and we just dig right there into those adhesions, breaking them up, helping with increase some pressure into those fibroblasts. Kills pain, helps the muscles relax, speeds up the healing process. And the cool thing about this technique is, we might be, in the first 2 weeks of care or so, right? The first week of care, we get a little bit of benefit through this area if you're coming in with some upper back or neck pain. In the second week, and maybe it starts to kind of plateau where it seems like it's not getting any better. If we attack it with the Graston at this point, we've seen some pretty remarkable change. Within about 2 to 3 visits, it seems like we seem to take care of about 80% of the pinpoint chronic pain, like the knife in the back type pain. Graston's pretty cool because we can do it for a whole lot of different techniques. We do it a lot for plantar fasciitis, low back pain, neck pain, but definitely a whole lot of upper back and shoulder is probably 90% of the time what we are using Graston on, okay? It can look pretty cool actually at the end. I'm just showing you a little bit of a demo of it, but we can actually kind of work through the neck, across the top of the shoulders, down in through the in between the shoulder blades, and just start to release a whole lot of that tension and start to release a whole lot of that pain. All right, so hopefully you found this interesting. This is Graston technique, or instrument-assisted soft tissue mobilization. If you have any questions, send them my way, and always remember to live with passion, not pain.